Hello, I'm here with your discharge paperwork. The doctor has prescribed you a new medication for you to take home and start. Um, it's a new diuretic since you're showing some edema. The name of the medication is going to be spalactone, and then the brand name is aldactone. And the reasoning for this medication is going to be the edema that you're showing in your lower extremities. Also with the hypertension that you've been showing as well. And also your new diagnosis of heart failure, which is in the 3 and 4. But that's also going to go into it in addition with other medications that you've been taking. And then so let's talk about how the medication is going to be working in your system. So spalactone is a potassium-sparing diuretic and also an aldosterone antagonist. So what this does, it's gonna it inhibits the aldosterone in your distal renal tubules, which is going to increase the sodium and water excretion in your urine, but it's going to hold on to that potassium. And then the way you're going to want to take this medication is the way the doctor has prescribed it to you. Either it's going to be 1 a day or BID, which is twice a day. And when you would want to take this is going to be during the daytime, because you would want to avoid nocturia, which is going to have you go to the restroom during nighttime a lot of the time. So disrupt your sleep and you'll just get up, go to the restroom, get up, go to the restroom. So to avoid that, you're going to want to take it early in the morning so that you're able to urinate throughout the day, and then again in the midday before you go to bed, so that you're able to release all the urine, all that extra fluid before you go to bed. You're also going to want to take this medication with some food in order to help with avoiding GI upset. And since this medication is potassium sparing, you're going to want to avoid potassium enriched foods like bananas, citrus fruits, tomatoes, dates, and apricots. Also with this medication, you're going to want to weigh yourself in the morning daily. So as soon as you wake up, use the restroom and then weigh yourself, because that's the most accurate weight that you would have. Also keeping a track of that, like a journal, and then also with your blood pressure as well. So you're going to want to monitor your blood pressure and keep a journal of that so that you could notify your doctor the next time that you go have your appointment. The possible labs that your doctor would want to monitor is going to be a serum potassium. This is just to ensure that you're not getting hyperkalemia and holding on to too much potassium. Also, they're most likely going to want to also get a sodium, a BUN, and also take a look at your creatinine to see how your kidneys are functioning. Okay, and then let's go over the common side effects or adverse effects to watch out for. Okay, so you could potentially experience headache, dizziness, confusion, hyperkalemia. That's when we were talking about you holding on to too much potassium. Hyponatremia, that's because you're going to be losing the fluid from your urine, and its salt is connected with water. So, and hypovolemia, meaning that you're losing too much. And when to call a doctor, or when you need to notify your provider, is when you're experiencing drowsiness, confusion, a rash, severe nausea, vomiting, diarrhea, dizziness, fainting, syncope, signs of hyperkalemia, which is irregular heartbeat, muscle weakness, also fatigue. These are all signs of an overdose. So you're going to want to notify your physician if you're experiencing anything like this, and then also seek medical attention immediately. Now, if there's anything else that you need from me, I will go ahead and get everything ready for you, and then we'll go ahead and go on our way. Thank you.